Hi, my name is Sydney Mathis, and I'm the Recruitment Coordinator at AdventHealth University. Joining me today is Julie Vincent, Chief Nursing Executive of the Central Florida Division at AdventHealth. Today we'll be talking about how AdventHealth and AdventHealth University works together to train highly skilled, dedicated, and compassionate nurses. Thanks for joining me, Julie. As a recruitment coordinator, one of the questions I get asked a lot is what motivates someone to become a nurse.
Well, I'm lucky in that I get a chance to spend time with nurses every day, and I get to ask them, why did you do what you do? How do you find joy in your work? And while they have different responses, the theme is the same, making a difference. Nurses are there to make an incredible difference in patients' lives. We're there to help patients recover from illness, help support their wellness journey. Nurses are there on good days and bad days. When you talk to patients, they will describe their experience with the health system in terms of before and after. Before I had a baby, after I had a baby. Before I had cancer, after I had cancer. The reason they use those words before and after is because their experience with our health system was life-changing, and nurses have a unique opportunity to be part of that life-changing experience.
That's awesome. One of the things that I hear a lot, like you mentioned, the before and after, a lot of nursing students, they have the same, response when it comes to nursing. So like, for example, before the pandemic and after the pandemic, I know we're still in the middle, but obviously things have kind of slowed down a little bit for us. So have you seen kind of the change in a motivation to become a nurse from before the pandemic and then after the pandemic?
Well, I think certainly one of the items that came out of the pandemic is a recognition of the incredible impact that nurses have on patient care. I think nurses have been recognized and celebrated for the unique role they played in the pandemic, and it's really become a catalyst for many individuals to explore becoming a nurse.
I agree with that. I hear a lot of the nursing students talk about the before and after in regards to the pandemic. One thing I hear them talk about a lot is, are they strong enough and do they have the support they need to become a nurse? So how would you answer that?
AdventHealth is an amazing place for nurses to work. Safety is our top priority. We take care of nurses because nurses take care of everyone else. One of the items we're excited to promote this year is our Professional Excellence Program. It helps support nurses in their growth and development journey. It helps recognize things like specialty skills, becoming a preceptor, or teaching others. And it not only provides recognition for ongoing growth and development of nurses' practice, it also provides compensation for achieving those levels. I think at nursing practice at AdventHealth, we really believe that nurses are the right individuals to make decisions for nursing practice. So we participate in what's called shared governance, which means that we believe nurses are the right individuals to bring forward ideas and innovation about nursing practice and work on improvements. This year we started our Nurse Advisory Panel, which is a group of direct care nurses, and they've already identified areas for improvement and giving nursing input into how and where we make decisions about those improvements. A great way to continue to support nurses in their practice by nurses.
So if someone were interested in becoming a nurse, what would be the best first step for them to take?
There are many avenues to becoming a nurse. Here at AdventHealth, we have many team members who are not nurses who are interested in becoming nurses, and we provide career coaching, an individual to help navigate the process and the options for becoming a nurse. AHU is our academic partner. AHU provides a Bachelor of Science in Nursing so individuals can start their degree in nursing, but they also provide ongoing academic learning, including advanced practice degrees for nurses who want to follow their dreams and become an advanced practice nurse. The AHU program is unique in that there's low teacher-to-student ratios. There's great clinical rotation support through the experience of training with our AdventHealth hospitals and clinical sites. But most importantly, AHU provides faith-based nursing curriculum, allowing individuals to learn how to deliver whole person care that impacts the mind, the body, and the spirit.
And as an AHU student myself, I know that we talk a lot about uncommon compassion and how we can use that uncommon compassion in healthcare. So how do you think that that applies to our nursing students in the nursing profession?
Uncommon compassion really refers to our mission to extend the healing ministry of Christ. And our mission means that it's our goal to ensure that every patient receives the kind of care that we would want, the kind of care we want for our own friends and for our own family. Patients tell us that they experience something different in our whole person care at AdventHealth. And nursing provides a role for individuals who resonate with that mission and who are interested in providing caring and love in their daily work.
So Julie, my last question for you would be, do you believe that nursing is something that you can learn through training at AHU? Do you believe that it's something that people usually grow up knowing that they want to do, or is it a little bit of both?
Our mission to extend the healing ministry of Christ appeals to people who are interested in finding a way to connect and support people with their work. And nursing is a great field to practice that type of giving and caring through nursing practice. Where I grew up in a college town, and there was a school of nursing across the street from my elementary school. I remember in 5th grade, some student nurses came to speak to my class about hand washing. I remember their pristine white uniforms and their knowledge of the science and their knowledge of what kept patients healthy. And I remember saying to myself, I'm going to be a nurse. If you ask any nurse, they will most likely relay that moment where they identified that they wanted to become a nurse. And many nurses refer to that as their calling.
Thank you so much for sharing that story with us, and thank you for joining me today.